Combined Pediatrics new keywords. Question 1. A 4-year-old has a temperature of 39.5 degrees Celsius. Which NCLEX priority action should the nurse take first? Administer prescribed antipyretic. Apply ice packs to the groin. Encourage fluid intake. Notify the physician immediately. Administering a prescribed antipyretic is the priority action to reduce fever and prevent febrile seizures. Question 2. Which finding in a 2-year-old requires immediate NCLEX priority nursing intervention? Heart rate of 110 bpm. Respiratory rate of 40 breaths/min bulging fontanelle. Capillary refill of 2 seconds. A bulging fontanelle in a toddler indicates increased intracranial pressure and requires immediate intervention. Question 3. A nurse is caring for a child with sickle cell crisis. Which NCLEX intervention has the highest priority? Administer 4 fluids as prescribed. Apply warm compresses to painful areas. Encourage ambulation. Restrict oral fluid intake. Hydration is the top priority in sickle cell crisis to reduce sickling and restore perfusion. Question 4. During NCLEX practice, a child with epiglottitis is admitted. What is the priority nursing action? Keep the child calm and upright. Place the child in Trendelenburg position. Obtain a throat culture immediately. Encourage oral fluids. Keeping the child calm and upright helps maintain a patent airway. Agitation worsens obstruction. Question 5. A 6-year-old is receiving 4 vancomycin. The nurse notes facial flushing and erythema. What should the nurse do first? Slow the infusion rate. Stop the infusion and call the physician. Administer diphenhydramine. Document the finding and continue. Red man syndrome is an infusion rate-related reaction. Slowing the rate is the first intervention. Question 6. Which developmental milestone is expected for a healthy 12-month-old? Speaking 50 words. Walking independently. Riding a tricycle. Drawing circles. Most children walk independently by 12 months of age. Question 7. A pediatric nurse assesses a neonate with suspected hypoglycemia. Which symptom is most significant? High-pitched cry. Jitteriness and tremors. Mild jaundice. Feeding eagerness. Jitteriness and tremors are classic signs of neonatal hypoglycemia requiring prompt treatment. Question 8. Which pediatric patient requires priority assessment by the nurse? A 7-year-old with a cast on the arm reporting mild itching. A 3-year-old with stridor and drooling. A 10-year-old with a sore throat and mild fever. A 5-year-old with a minor laceration. Stridor and drooling in a toddler suggest epiglottitis or airway obstruction, a life-threatening emergency. Question 9. A pediatric nurse educates parents about immunization. Which statement indicates correct understanding? MMR vaccine is given at 9 months only. My child may have a low-grade fever after the vaccine. Vaccines cause the disease they prevent. My child should avoid other children for 2 weeks after vaccination. A low-grade fever is a common, expected response to many vaccines and indicates immune activation. Question 10. An LPN is caring for a child post-tonsillectomy. Which finding should be reported to the RN immediately? Mild throat discomfort. Frequent swallowing. Preference for cold liquids. Sleeping most of the day. Frequent swallowing post-tonsillectomy is a sign of active bleeding and must be reported immediately. Question 11. Within the LPN scope of practice, which action is appropriate when caring for a febrile child? Administering prescribed oral antipyretics. Interpreting laboratory results. Developing a new care plan. Adjusting 4 medication doses. Administering prescribed oral medications falls within the LPN scope of practice. Question 12. An LPN notes a child's apical pulse is 58 bpm. What is the appropriate action? Document and continue monitoring. Immediately administer atropine. Report the finding to the supervising RN. Encourage oral fluids. A bradycardic rate is abnormal in a child. The LPN should report to the RN for further assessment. Question 13. A child with acute asthma has an O2 saturation of 90%. Which intervention is most urgent? Administer prescribed bronchodilator via nebulizer. Encourage slow deep breathing. Obtain a sputum culture. Restrict activity. A bronchodilator is the priority to relieve bronchospasm and improve oxygenation in acute asthma. Question 14. A parent asks the nurse about expected weight gain in infancy. Which response is correct? Infant's double birth weight by 12 months. Infant's triple birth weight by 12 months. Infant's quadruple birth weight by 6 months. Infants maintain birth weight for 3 months. Infants typically triple their birth weight by 12 months of age. Question 15. Which is a normal finding in a newborn during the first 24 hours of life? Cyanosis of the hands and feet. Central cyanosis. Absent Moro reflex. Bulging anterior fontanelle. Acrocyanosis, bluish discoloration of hands and feet, is normal in neonates due to peripheral vasoconstriction. Question 16. A CPN candidate is studying growth parameters. Which weight classification applies to a child at the 3rd percentile? Normal. Overweight. Underweight. Obese. A weight below the 5th percentile for age is classified as underweight. Question 17. For the CPN exam, which is the leading cause of death in children aged 1 to 4 years in the U.S.? Congenital anomalies. Unintentional injuries. Malignant neoplasms. Respiratory diseases. Unintentional injuries are the leading cause of death among children aged 1 to 4 years. Question 18. A child with Kawasaki disease is in the acute phase. Which CPN level finding is expected? Low-grade fever for 2 days. High fever lasting more than 5 days. Purpuric rash on the trunk. Recurrent episodes of hypoglycemia. Kawasaki disease is characterized by a high fever persisting for 5 or more days as a hallmark sign. Question 19. A CPN practice candidate reviews pain assessment. Which scale is best for a 3-year-old? Numeric rating scale, 0 to 10. FLAC scale. Visual analog scale. McGill Pain Questionnaire. The FLAC scale is validated for children 2 months to 7 years who cannot self-report pain. Question 20. Which immunization is recommended for all healthy infants at 2 months of age? Varicella. DTaP. Hepatitis A HPV. DTaP, diphtheria, tetanus, acellular pertussis, is part of the routine 2-month immunization schedule. Question 21. A child with cystic fibrosis is admitted for a pulmonary exacerbation. Which intervention is most important? Chest physiotherapy and airway clearance. Restricting fluid intake. Administering antihistamines. Decreasing caloric intake. Airway clearance is a cornerstone of cystic fibrosis management during pulmonary exacerbations. Question 22. Which vital sign range is normal for a 5-year-old child? HR, 60 to 100 bpm, RR, 12-18/min HR, 80 to 120 bpm, RR, 22-34/min HR, 100 to 160 bpm, RR, 30-60/min HR, 50 to 90 bpm, RR, 10-15/min. Normal HR for a 5-year-old is 80 to 120 bpm and RR is 22 to 34 breaths/min. Question 23. A nurse is preparing discharge teaching for a child with type 1 diabetes. Which instruction is most important? Avoid all carbohydrates. Recognize signs of hypoglycemia. Administer insulin only when symptomatic. Restrict physical activity. Children with type 1 diabetes must recognize hypoglycemia symptoms for safe self-management. Question 24. Which finding in a newborn requires immediate notification of the provider? Lanugo on the back. Respiratory rate of 70 breaths/min vernix caseosa in skin folds. Stool within 24 hours. A respiratory rate above 60 breaths/min in a neonate indicates respiratory distress requiring evaluation. Question 25. A PNP assesses a 9-month-old and finds the anterior fontanelle closed. How should the PNP interpret this finding? Normal developmental variant. Possible premature craniosynostosis. Expected at this age. Sign of dehydration. The anterior fontanelle typically closes between 12 to 18 months. Early closure may indicate craniosynostosis. Question 26. A PNP is evaluating a child for ADHD. Which is the most important diagnostic criterion per DSM-5? Symptoms present only at school. Symptoms present in 2 or more settings for at least 6 months. Symptoms beginning after age 12. Only hyperactivity symptoms. DSM-5 requires symptoms in 2 or more settings for at least 6 months to diagnose ADHD. Question 27. A 14-year-old presents with primary amenorrhea. Which assessment is the PNP's first step? Obtain a pelvic ultrasound. Check serum FSH and LH. Assess Tanner staging. Prescribe oral contraceptives. Tanner staging provides essential baseline information about pubertal development before ordering investigations. Question 28. A PNP evaluates a 2-year-old who is not yet speaking in 2-word phrases. What is the best next step? Reassure the parents it is normal. Refer to speech-language therapy. Recommend a hearing test first. Wait until age 3 to reassess. Hearing loss is a common and treatable cause of speech delay and should be ruled out first. Question 29. A child has a positive tuberculin skin test, TST, with 12 mm in duration. The PNP should first start prophylactic isoniazid. Order a chest X-ray. Repeat the TST in 4 weeks. Notify public health immediately. A chest X-ray is performed to determine if active TB disease is present before starting treatment. Question 30. A PNP is prescribing amoxicillin for acute otitis media. Which child is the exception for first-line treatment? A 3-year-old with moderate ear pain. A 2-year-old with penicillin allergy. A 5-year-old with bilateral AOM. A 4-year-old with fever and AOM. Children with penicillin allergy require an alternative antibiotic such as azithromycin or ceftonir. Question 31. A child with meningitis is placed in droplet precautions. The nurse explains the rationale. Which statement is correct? Bacterial meningitis spreads via airborne particles. Droplet precautions prevent respiratory spread of Neisseria meningitidis. Meningitis is transmitted by direct contact only. Droplet precautions are not required after antibiotic initiation. Neisseria meningitidis spreads via respiratory droplets. Droplet precautions prevent transmission. Question 32. A 7-year-old is receiving chemotherapy and develops neutropenia. Which intervention is most important? Rationale required. Restrict all visitors. Monitor temperature and report fever greater than or equal to 38 degrees Celsius promptly. Administer prophylactic antibiotics without orders. Encourage a high-fiber diet. Neutropenic fever is an oncological emergency. Prompt detection and treatment prevent septic shock. Question 33. An infant is diagnosed with pyloric stenosis. Which electrolyte imbalance does the nurse expect? Rationale? Hyperchloremic metabolic acidosis. Hypochloremic metabolic alkalosis. Hypernatremic dehydration. Hyperkalemic metabolic acidosis. Repeated vomiting in pyloric stenosis causes loss of HCl and K+, leading to metabolic alkalosis. Question 34. A child with nephrotic syndrome gains 2 kilograms in 24 hours. What does this indicate and what is the nurse's action? Normal hydration, continue monitoring. Fluid retention, restrict sodium and fluids as ordered. Improved nutrition, increase caloric intake. Diuresis, decrease 4 fluid rate. Weight gain in nephrotic syndrome reflects edema from fluid retention, sodium restriction reduces it. Question 35. A nurse teaches parents of a child with iron deficiency anemia. Which food should be avoided with iron supplements? Orange juice. Milk. Green leafy vegetables. Red meat. Calcium in milk inhibits iron absorption. Iron supplements should not be taken with dairy products. Question 36. A postoperative child has absent bowel sounds and abdominal distension 48 hours after surgery. What should the nurse do? Encourage oral fluids to stimulate bowels. Report findings to the surgeon. Administer a suppository. Document and monitor every 4 hours. Absent bowel sounds with distension suggest ileus or obstruction. The surgeon must be notified promptly. Question 37. A 6-month-old is brought to the clinic. Which solid food is most appropriate to introduce first? Peanut butter. Iron-fortified single-grain cereal. Honey. Whole milk. Iron-fortified single-grain cereal is recommended as the first solid food due to its iron content and low allergenicity. Question 38. A child with asthma uses a peak flow meter. A reading in the yellow zone means? The child is safe for normal activity. The child needs a reliever inhaler and physician notification. The child should be hospitalized immediately. The child can reduce medication. The yellow zone, 50 to 80% of personal best, indicates caution and need for reliever medication. Question 39. The nurse observes a child with seizures that last 45 seconds followed by confusion. This is most consistent with absence seizure, tonic-clonic seizure with postictal phase, febrile seizure, myoclonic seizure. A tonic-clonic seizure is characterized by rhythmic convulsions followed by a postictal confusion phase. Question 40. A 10-year-old has a BMI at the 97th percentile. How is this classified? Healthy weight, overweight, obese, underweight. A BMI at or above the 95th percentile for age and sex is classified as obese in children. Question 41. An infant with Down syndrome is being assessed. Which cardiac defect is most commonly associated? Coarctation of the aorta, atrioventricular septal defect, tetralogy of Fallot, transposition of great arteries. Atrioventricular septal defect, AVSD, is the most common congenital heart defect in Down syndrome. Question 42. A child presents with Koplik spots and a maculopapular rash spreading from the face downward. The nurse suspects? Rubella, roseola, rubeola, measles, scarlet fever. Koplik spots, white spots on buccal mucosa, followed by a descending rash, are pathognomonic for measles. Question 43. A test bank question. A nurse is caring for a child in Bryant's traction. Which assessment is priority? Pain at the traction site, peripheral neurovascular status of both legs, skin integrity under the traction straps, emotional response to immobility. Neurovascular assessment, circulation, sensation, movement, is the priority to detect compartment syndrome. Question 44. A 3-year-old is admitted with croup. Which finding indicates worsening respiratory distress? Barking cough at night only, inspiratory stridor at rest, hoarse voice, mild nasal congestion. Stridor at rest, as opposed to only with activity, indicates significant airway narrowing in croup. Question 45. An infant has been diagnosed with RSV bronchiolitis. Which nursing intervention is most important? Administer prescribed corticosteroids. Maintain airway patency and monitor oxygen saturation. Encourage solid foods. Restrict 4 fluids. Supportive care focusing on airway and oxygenation is the mainstay of RSV bronchiolitis management. Question 46. A nurse reviews a test bank question about lead poisoning. Which blood lead level requires chelation therapy? 5 micrograms per deciliter, 10 micrograms per deciliter, 45 micrograms per deciliter, 20 micrograms per deciliter. Chelation therapy is indicated for blood lead levels greater than or equal to 45 micrograms per deciliter in children. Question 47. A child with hypothyroidism is prescribed levothyroxine. Which assessment confirms therapeutic effect? Decreased heart rate, normal growth and developmental progression, increased blood pressure, weight loss. Normal growth velocity and developmental milestones confirm adequate thyroid hormone replacement. Question 48. A nurse assesses a child with Wilms tumor. Which nursing action is critical? Palpate the abdomen frequently to monitor tumor size. Avoid abdominal palpation. Encourage vigorous physical activity. Position the child prone. Abdominal palpation in Wilms tumor is contraindicated as it may rupture the tumor capsule and spread cancer cells. Question 49. A final exam question. An infant is in a car seat. Which position is correct for a 6-month-old? Forward-facing, front seat. Rear-facing, back seat. Forward-facing, back seat. Booster seat, back seat. Infants should be rear-facing in the back seat until they outgrow the rear-facing weight/height limit. Question 50. A nurse prepares a child with appendicitis for surgery. Which finding would cause the nurse to withhold pre-op medication and notify the surgeon? Pain at McBurney's point. Sudden relief of abdominal pain. Mild nausea. Temperature of 37.8 degrees Celsius. Sudden pain relief may indicate rupture of the appendix, which is a surgical emergency. Question 51. Which action by the nurse best supports a toddler's autonomy during hospitalization? Making all decisions for the child. Offering limited, simple choices. Restricting parental visits. Enforcing a strict daily schedule. Offering simple choices, e.g., which arm for the 4, supports autonomy and reduces loss of control. Question 52. A Quizlet-style final exam. A child is prescribed digoxin 0.04 mg PO. The available concentration is 0.05 mg per milliliter. How many ml does the nurse administer? 0.6 milliliters. 0.8 milliliters. 1 milliliter. 1.2 milliliters. 0.04 milligrams divided by 0.05 milligrams per milliliter equals 0.8 milliliters is the correct dose calculation. Question 53. The nurse is teaching parents about the signs of dehydration in an infant. Which sign is most reliable? Dry mouth. Decreased urine output, fewer than 6 wet diapers/day. Mild irritability. Low-grade fever. Decreased wet diapers is the most practical and reliable early sign of dehydration in infants. Question 54. A 4-year-old is to receive amoxicillin 250 mg PO. The suspension available is 125 mg per 5 milliliters. How many ml should be given? 5 milliliters. 10 milliliters. 15 milliliters. 2.5 milliliters. 250 milligrams divided by 125 milligrams times 5 milliliters equals 10 milliliters is the correct calculated dose. Question 55. A sample question. A 2-month-old has a rectal temperature of 38.1 degrees Celsius. What is the nurse's priority action? Administer paracetamol. Notify the physician immediately. Apply a cool compress. Encourage breastfeeding. Any fever in an infant under 3 months is a medical emergency due to risk of serious bacterial infection. Question 56. A nurse assesses a child with suspected intussusception. Which finding is characteristic? Watery diarrhea. Current jelly stools. Projectile vomiting after feeds. Abdominal rigidity. Current jelly stools, blood and mucus, are a hallmark sign of intussusception due to mucosal ischemia. Question 57. The nurse teaches a parent about safe sleep for a newborn. Which instruction is correct? Place the baby on a soft mattress with a pillow. Place the baby supine on a firm, flat surface. Share the parent's bed for warmth. Cover the baby's head with a hat during sleep. Supine position on a firm flat surface reduces the risk of sudden infant death syndrome, SIDS. Question 58. A child with pyloric stenosis will most likely present with bilious vomiting, non-bilious projectile vomiting, watery diarrhea, bloody stools. Pyloric stenosis causes obstruction proximal to the bile duct, resulting in non-bilious projectile vomiting. Question 59. The nurse monitors an infant receiving phototherapy for hyperbilirubinemia. Which intervention is essential? Cover the infant's eyes with eye patches. Limit feeding to prevent aspiration. Keep the infant clothed to prevent cooling. Restrict fluid administration. Eye patches protect the infant's retinas from damage caused by the phototherapy light. Question 60. A school-age child is started on methylphenidate. Which side effect does the nurse most closely monitor? Weight gain, insomnia and decreased appetite, increased appetite, bradycardia. Stimulant medications commonly cause insomnia and appetite suppression in children with ADHD. Question 61. A child admitted with diabetic ketoacidosis, DKA, should be monitored for which complication during treatment? Hyperkalemia, cerebral edema, hypertension, pulmonary embolism. Rapid fluid replacement in DKA can cause cerebral edema, especially in children, a life-threatening complication. Question 62. A 5-year-old requires a urine specimen. Which collection method is most appropriate? Urinary catheterization, clean catch midstream urine, suprapubic aspiration, urine bag collection. For a 5-year-old who is toilet trained, clean catch midstream urine is the least invasive and most appropriate method. Question 63. The nurse reviews iron administration instructions. Which is correct? Administer with milk to prevent GI upset. Give iron through a straw to prevent teeth staining. Take iron with antacids for better absorption. Administer with calcium supplements. Liquid iron should be given through a straw because it can stain the teeth. Question 64. A nurse is caring for a child with burns covering 18% of the body surface area. Which finding indicates adequate fluid resuscitation? Urine output of 0.5 to 1 ml/kg/hour. Systolic BP below 70 mm of mercury. Heart rate of 160 bpm. Serum sodium of 125 milliequivalent/L. Urine output of 0.5 to 1 ml/kg/hour is the target to confirm adequate fluid resuscitation in a burned child. Question 65. A newborn has not passed meconium within 48 hours of birth. The nurse should first give a glycerin suppository. Notify the neonatal provider. Increase formula feeding. Place on bowel rest. Failure to pass meconium within 48 hours may indicate Hirschsprung disease. The provider must evaluate the infant. Question 66. A child with rheumatic fever must receive penicillin prophylaxis. The parent asks why. The best response is to treat the current infection, to prevent recurrent streptococcal infections and cardiac complications, to reduce joint pain, to lower the fever. Prophylactic penicillin prevents recurrent streptococcal infections that could worsen rheumatic heart disease. Question 67. A nurse practices pediatric assessment. When assessing a toddler's abdomen, the nurse should start with deep palpation in all 4 quadrants. Auscultate bowel sounds before palpation. Percuss immediately after inspection. Palpate the tender area first. The correct order for abdominal assessment is inspection, auscultation, percussion, palpation, to avoid altering bowel sounds. Question 68. Which pediatric pain assessment tool is appropriate for a 5-year-old child? Kreis scale, Wong-Baker-Faces scale, Nip scale, Comfort scale. The Wong-Baker-Faces scale is validated for children aged 3 years and older who can self-report pain. Question 69. The nurse teaches parents about fever management in children. Which instruction is correct? Aspirin is the drug of choice for fever in children. Tepid sponge baths are recommended as primary fever treatment. Paracetamol can be given every 4 to 6 hours as directed. Bundle the child in blankets to sweat out the fever. Paracetamol dosed every 4 to 6 hours is the recommended first-line pharmacological fever management in children. Question 70. A pediatrics quiz question: which fontanelle closes last in a healthy infant? Posterior fontanelle, anterior fontanelle, mastoid fontanelle, sphenoidal fontanelle. The anterior fontanelle is the last to close, typically between 12 to 18 months of age. Question 71. In a pediatrics quiz, a child with epiglottitis arrives in the ED. The nurse's first action is: obtain a throat culture. Keep the child calm and in a comfortable position. Prepare for immediate oral intubation. Administer oral antibiotics. Maintaining a calm environment and allowing the child to assume a position of comfort is priority to avoid complete airway obstruction. Question 72. A nurse quiz reviews medication safety. The maximum single dose of paracetamol for a 20 kg child is 200 mg, 300 mg, 400 mg, 500 mg. Paracetamol dosing is 10 to 15 mg/kg per dose. For a 20 kg child, 15 mg per kilogram equals 300 mg max per dose. Question 73. A child is admitted with suspected bacterial meningitis. Which nursing intervention is the priority? Perform a lumbar puncture immediately. Administer prescribed antibiotics without delay. Obtain blood cultures before any treatment. Place the child in a private room. Antibiotic administration is the priority in bacterial meningitis to prevent death and neurological sequelae. Question 74. A nurse assesses a 1-year-old with suspected developmental dysplasia of the hip, DDH. Which test is used? Ortolani and Barlow maneuvers. McMurray's test. Trendelenburg sign. Lockman test. Ortolani and Barlow maneuvers are used to assess hip instability in infants for DDH. Question 75. A child with Reye syndrome requires close monitoring for which complication? Renal failure. Increased intracranial pressure. Hyperglycemia. Pulmonary edema. Reye syndrome causes cerebral edema and increased ICP, which is the primary life-threatening complication. Question 76. A PDF-style exam question. An 8-year-old with type 1 diabetes has a blood glucose of 50 mg per deciliter and is alert. What should the nurse give first? 450% dextrose. 15 grams of fast-acting carbohydrate orally. Glucagon IM. Insulin correction dose. The 15-to-15 rule. Give 15 g fast-acting carbohydrate orally for conscious hypoglycemia, then recheck in 15 minutes. Question 77. A PDF exam question. A child is placed in Pavlik harness for DDH. Which parental teaching is most important? Remove the harness for nappy changes. Never remove the harness without physician guidance. The harness is only worn at night. Tighten the straps if the child seems comfortable. The Pavlik harness must not be removed without medical guidance, as improper removal can worsen hip dysplasia. Question 78. A child with G6PD deficiency is prescribed medication. Which drug is CONTRAINDICATED? Paracetamol. Primaquine. Amoxicillin. Ibuprofen. Primaquine is an oxidative drug that triggers hemolytic anemia in children with G6PD deficiency. Question 79. A pediatric nurse assesses growth. A child's weight is at the 10th percentile and height at the 50th percentile. This most likely indicates normal growth. Concern for underweight. Normal proportional growth. Obesity. Weight significantly below height percentile suggests the child may be underweight and warrants nutritional assessment. Question 80. Which sign is characteristic of a child with increased intracranial pressure? Tachycardia and hypotension. Cushing's triad, bradycardia, hypertension, and irregular respirations. Hyperthermia and diaphoresis. Low blood pressure and tachypnea. Cushing's triad is the classic late sign of critically raised ICP and requires emergency intervention. Question 81. A nurse provides oral rehydration therapy, ORT, to a toddler with mild dehydration from diarrhea. Which approach is correct? Give 200 milliliters all at once every hour. Give 5 to 10 milliliters by spoon every 1 to 2 minutes. Restrict fluids for 4 hours first. Switch to formula immediately. Small, frequent amounts prevent vomiting and promote absorption during ORT in young children.